What's going on, Jake?
Not much. Just hanging out. Poured myself a little drink.
There you go. What's
Yeah.
in that drink right there? What do you got going on?
We got some Coca-Cola and some Proper 12 whiskey. It's
You're going
Conor
Irish.
McGregor's. Yep.
Nice. How do you
Have you
like
ever
it?
had it?
Yeah, I've had a couple of times. I haven't had it in probably like a year or two, but
It's good. It's like very very smooth. It's not
yeah,
like I like Jack Daniel's too, but it's Kentucky bourbon. That's a little more like harsh. But the Proper
yeah.
12 is solid.
There you go. Right on. Yeah, that was a fun one to. I got into it when like he was towards the end of his prime as a fighter, and so that's kind of why I got into it a little bit, and then I just started going to other whiskeys.
Yeah, when I found out he made a whiskey, I'm like, sweet, I'm definitely trying this.
I have to try it. Exactly.
And it was great. And it still
There you
is
go.
great.
Yeah. Heck yeah, man. Yeah, I got some tin cup over here. I just
Okay.
finished. I had a little bit left, so I put that in. And I know we talked about this, but for people watching, if you're watching the video, it looks like a lot, but I promise it's a small glass and a big ice cube, so it's not too much. But
Displacement. That's
yes,
water displacement.
right, right. But yeah, so anyways, so I'll get into kind of what this podcast is about. And for people listening, Christian isn't here right now. Unfortunately, he had something come up, but he might join us like partway through. So if you're listening and then a third person randomly jumps in, that's because Christian was able to find some time to join us. But we're going to do a little bit different podcast for this episode. I know if you've been listening to this for a while now, Christian and I go into certain research articles and break things down and kind of put it in layman's terms for individuals able to use that information in their everyday life.
Like me.
But exactly like Jake. But today we're going to do something a little bit different. So our guest today is none other than Jake Fischer. He's also maybe known as Voices of Jake if you follow him on social media. And if you haven't yet, get this sweet T-shirt that I'm wearing. Jake's Elmo T-shirt. There we go, dude.
It's got an axe.
I love it. I have a story about that for you some other time. So Jake will be asking us the questions tonight, kind of like an FAQ style about physical therapy. And we have some fun discussion back and forth. The idea is that Jake is, I would consider you a great conversationalist, very nice, easy to get along with type of guy. And we felt like, Jake, you're going to be really good at being able to just dive into these discussions with us because also you're just, I would say, generally interested in kind of what's going on in the world of physical therapy
Yeah.
and health and fitness.
Yeah. And a little bit of background. Eric and I
Yeah.
grew up together. My
Yes.
best friend is Eric's not oldest brother, second oldest brother. So I was always at the Norman house and we've just been friends ever since. But we were kind of talking about it. I'm like, my uncle's a PT, my other good friend is a PT, Eric's a PT, and it's like I know a little bit about it, but there's so much that the majority of the population have no clue about. They're like, well, what is it? Like, so I think that'll be fun to I'm the layman, I'm the consumer, and then you guys are the professionals, and we can kind of, I don't know, get some information.
Yeah, exactly. That's spot on to kind of what we're going after here. And it's supposed to be a fun podcast. Like
Yeah.
you might have saw in the beginning here, Jake's got his whiskey and Coke. I got whiskey on the rocks. We're just going to have a laid back, fun conversation. Who knows what the conversation is going to bring? It might get a little ranty at times, but that's okay.
Yeah. Yeah.
And just a little background on you, Jake. I just want to let people know I already mentioned your online profile of Voices of Jake. Also, I would consider you, Jake, just an online content creator. You have over 260,000 followers on Instagram, over 2.4 million followers on TikTok. Passions, as you can see, is axe creation, makes axes and woodworking.
This bad boy, this is my newest one.
That's a
So I
sweet
got a
axe.
redwood burl for the palm swell, and then this is walnut.
That's
And
so
then this
cool.
is a hand forge. I did not forge this. I just do handles and I restore heads, but a buddy of mine forged this. So I put it on a dope ass handle.
There you go, man. There you go. Are you ever gonna forge? Are you gonna think about forging the axe head?
I've thought about it. It's just such a process. And to like get started, I already have so many woodworking tools.
Mm,
Like I have a huge drum sander that's like stupidly expensive. Luckily, it was gifted to me for like affiliation type stuff, but
yeah.
just so much money in woodworking tools that it's like I'd have to spend even more money on forging tools, and like you need a big press, you could use power hammers of the forge itself to actually heat up the metal, and the propane cost, and I don't know. Those guys are next level, and I don't know
Yeah.
if I'm there yet or if I want to be. I don't know. I just love the woodworking.
Yeah, man. Yeah, absolutely. No, and I mean, that's such a, yeah, I think a unique thing, and it's kind of I feel like it's kind of a lost art. So I think it's really cool that you're doing that stuff and putting it out there. And also, if you didn't catch, he does a lot of really funny and sweet impersonations. So if you heard the Elmo one, that's pretty spot on. I was
Hence,
actually going to ask you
voices
to
of
do
Jake.
exactly. I was actually going to ask you to kick off the episode with an Elmo impersonation, but we
There
already
we
checked
go.
that box. So, anything else, Jake, that you want to throw in there in terms of like who you are, how you got started, all that type of stuff, just for the listener?
Yeah, I'll do a little bit of synopsis. I've always wanted to do voices, and just grown up playing with little action figures, I would do voices and just really enjoyed that. And then as I got older, I'm like, wow, this is kind of like people do this for a career. And then I started doing it on Snapchat for my friends, and then they're all like, hey, you should do an Instagram, you should do a TikTok. And I'm like, okay. And then I did, and then it kind of just blew up. And then, yeah, I just kind of mix in comedy, voices, and now my passion for woodworking and axes, and just overall, I wouldn't say influencer, I would say more just entertainer. I just try to just make people laugh and have a good time. And generally right now in this, well, it's warm now, but in the winters, I like to freeze my face and freeze my hair. So I always have at least one viral video every single winter of me just frozen, because in Minnesota where I
Yeah,
am, it gets -30, -20 like a week at a time, and then that's when I go out and I just spray my face, and yeah. But yeah, so
that's
just
your
entertainment.
yeah, right on, man. That's your bread making time right there.
Honestly though, that's what I'm known for. And like it's funny, I've had a lot of people, a lot of like companies reach out, all those like viral media websites like Viral Bear and Puberty and like Unilad and Lad Bible and all those. They always reach out and they say, "Hey, can we license this?" and blah 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 blah.
Yeah,
And it's always, I don't know. I've worked with people in the past for that, and it's very shady. They don't really tell you what they're paying you for, or if they are paying you what they should, and like whatever. So I just basically say, I'm like, yeah, you have my permission, just post it, tag me. So I don't know if you saw like the puberty one. It was like, hey, they reached out. We love your video. Can we post it? I'm like, yeah, for sure. Like make more people laugh. And
absolutely. Yeah.
but then it's really cool. Like I've had a few like Weather Channel
Oh
TV
wow.
shows. They're just like, "Hey, we want your video." I'm like, "Okay, cool." And then this year, a Japanese TV show was like, "Hey, we'd love these to use these three videos." I'm like, "Hell yeah!"
Yeah, let's do it.
Yeah.
Yeah, that's
So it's
awesome,
it's
man.
pretty cool. I'm just reaching all over the world, and yeah, if affecting. I'd like to think affecting a lot of people positively. So,
Right, right on. Yeah, that's great.
but yeah,
Using social media for what the positive sides are, the
exactly.
positivity, laughter, all that stuff, not the
Yeah,
negative crap
not all
that
the
we see.
fear mongering and BS that we have to deal with. But I mean,
Hmm.
similar to like what you guys are doing, you're trying to reach people positively about PT specifically.
Yeah, yeah, absolutely, man. 100%. That is very much what we try to do. And I would like to think that, unfortunately, there is some with, especially in like physical therapy, I feel like you see stuff online of like, is your back this posture? Do you have this certain posture that's ruining your joint health and all this other stuff? And majority of the time, like we know through research, like that stuff just isn't real. And it's
Yeah,
like part of what we do on here is we try and just tell people like
debunks
one of my
some of that stuff.
yeah, exactly. Like one of my I would say I don't know if idol is the right word, but someone I listen to a lot and look up to as a physical therapist. He's actually out of Canada. Greg Lehman, we mention him on here all the time, but his his whole bit is about like movement optimism. So looking at the body in a more positive light rather than like you have all these things wrong with you. It's more about no, your body is just really freaking good at adapting and look at how
Yeah,
well it's doing with how you're functioning. So
That's cool.
yeah, it's I'd like to think we try and promote that as well.
Yeah. Because I mean, with every profession, there's going to be, and especially with social media, there's going to be the
Hmm.
people in the organizations that are trying to take advantage or just be clickbaity and just like, I don't know. And I don't want to bash on anyone, but chiropractors
Yeah,
kind of they're way I don't really see PTs as like the witch doctors, but chiropractors like they always do this crazy like, oh, I can crack your neck and I'm gonna fix your brain and like all this crazy. I'm like, what are you guys even doing? Like PTs are actually doing something with your
yeah,
muscles and your. I mean, I don't know a lot, in which I want to get into, but like
yeah,
you
absolutely.
guys focus on muscles, skeletal muscles, joints, or not so much joints.
We do joints. Yeah, we'll work with joints and whatnot. Yeah, like arthritis and that type of stuff.
Yeah, okay, but
Yeah,
a lot of movement and healthy practices for your muscles.
definitely with chiropractors. You get into
Yeah,
that for
what are
sure.
your
I mean,
thoughts? What are your thoughts of chiropractors?
yeah, I think this is what I'll start off by, just before we get into details. Like, I'll start off by saying what I tell my patients, and that's I think that everyone in healthcare has their roles, right? They all have their benefits and whatnot. I mean, for example, like 2 years ago, I kind of had some pain in my upper back from a workout I did, and I just couldn't quite get rid of it. I went to a chiropractor. He adjusted my back, and he just that it took one session of an adjustment where he just cracked my back, and I was able to get back on track. Like, that's all I needed.
Yeah, yeah,
And so, like, there's definitely situations like that where I think chiropractors can be really good for.
exactly.
We have chiropractors where I work, and they're very much like, I would say they're very more research based than most chiropractors. And they tell their patients, because they're not trying to make, they get paid a salary. They're not trying to get patients back for more visits. And
Yeah, yeah.
so they'll tell patients straight up, like, yeah, like, chiropractor, it's not going to work for you. It's just not the best fit for you right now, right?
I would go
Whereas,
here, I would look into this or see a PT or whatever.
yep, exactly. Yeah.
Yep.
And so there's definitely, the chiropractors that I work with that I'm very fortunate to work with, and it's because they're not making, it's not their own business, right? It's
Yeah,
different.
in every profession, there are the people that are just not crazy, but crazy, a little bit
Yeah.
delusional. Like there are some doctors that are just like, what are you thinking? Because my
Yeah.
dad's a doctor for
Right.
people watching, but he's got a little more even keel perception. He's been doing it for 30 years. And like he's just kind of, I guess, a little more neutral, not super extreme one way or the other. And then there are
Hmm.
some that are like super crazy. But I saw Gibbs. Remember Gibbs?
Yep. Yeah.
Yeah, so I saw him because I was having some issues with my back, and I'm like, I don't know anything about chiropractors. Like, yeah, some of them are a little bit goofy. Like, they'll hook you up to this machine and monitor your brain waves and then crack you and then you're cured. I'm like, that sounds weird. But
Yeah.
Gibbs is like what you've described. He's very like, he's like, so what chiropractors do, we do an adjustment, we crack your back, whatever. Some people don't like to call it that. Some chiropractors are like, oh, we're not cracking your back, we're adjusting you. But Gibbs
Yeah.
is like just super nice. He's like, yeah, we'll see if it works. We can do this. You seem pretty tight, so let's do some cracks and we'll put you on your way. And like he's an amazing medical professional. But I guess in every profession there are the ones that just make the entire profession look bad. And I think chiropractors get a lot of that heat because some of them are just like, whoa, man,
Yeah.
just chill.
Yeah. 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 And unfortunately, some of like, it's the louder voices come through, right? And so it's,
Especially with social media.
yeah.
Like have you seen the chiropractors that do animals?
Yes. Yeah.
Those
And
videos, it's like this pit bull, and all of a sudden he
yeah.
takes this neck and just like, and I'm like,
Yeah.
oh my
Yeah.
god, what
You
in
just
the
killed the
world?
dog. Yeah.
Yeah, and then the dog's
Yeah.
just sitting there like this, like, do I want to bite your face off right now, or did you make me feel good? I don't know what's happening. It's just so weird.
I know it, and so, like, there's different things like that, and then a lot of times, chiropractors also, there's different routes to it. Like, that's the thing
Mm,
with chiropractic schools. There's so many different, like trains of thought, I guess, or philosophies, and
yeah.
so some of them will be like very holistic, right? And there's one of the one of the things I was very fortunate to read early on, who his name is Andy Galpin. He's a muscle physiologist, and he
Cool.
talks about, yeah, he's just a badass dude. Like he's front of the line research when it comes to muscle physiology and all that really cool stuff. But he talks about how, there's a continuum of research, right? There's kind of
Hmm.
like theoretical research and like case studies on one end, which wouldn't be thought of as being very, very like hardcore research, And then on
Yeah,
the
yeah,
other end,
more of thought.
yeah, you have more of what's called like systematic reviews and meta-analysis, where they take research upon research and they condense it to tell you, what all the research says about this certain thing.
Mm,
And he says like everywhere on the continuum has a place, right?
yeah,
If we
exactly.
only practiced in meta-analyses and systematic reviews, like we would have very few things that we're certain about, unfortunately, just because research is conflicting, right?
Yeah,
And
yeah,
so, because of that, we also need to incorporate some of the other things like case studies and more the theoretical research of, it makes sense that this could be the case, but we haven't had any research on it yet.
yeah. But it also like gets people to think about like, hey, maybe we can connect these dots and have this idea in our mind until we have the research to either prove it or disprove it or but yeah, there's a place for all of it, really.
Yeah, yeah, absolutely. I totally agree. And I would say that physical therapy, we are much more rooted in the meta-analyses, systematic reviews. You look at what Christian and I talked about in previous podcasts, a lot of them are based on what's called CPGs or clinical practice guidelines. And those are all systematic reviews around a certain thing like, like plantar fasciitis,
Yeah, okay.
like we have a CPG on that, and it tells us everything from, how to diagnose it, how to treat it, like how much people are going to get better, how much people aren't going to get better. Like it's very
Oh,
much rooted
interesting.
in research. That's more of what PTs practice off of, I would say. And I would say like there's also some, again, things online where people promote these different trains of thought where a lot of us would probably be like, oh, that's poo poo science. Like that's not, like you're
Yeah.
just making that up. There's nothing to prove it. But those are also the same people that sell a lot of stuff and get a lot of clicks, you know?
Yep.
So
I
it's
know
kind of
it's
hard to
hard to
decipher.
yeah, exactly. But that's why informational podcasts need to exist because you talk to professionals and I mean all professionals. Like some of them have different opinions than you and the other person, so it's like it's good to get all this information and be like, "Oh yeah, okay, I
Yeah.
agree with this or let's try this." So plantar fasciitis for instance. So all that research and all the data analysis essentially of patients and how it works in your muscles and physiology you can see someone and basically say, "Oh, you have plantar fasciitis, you get this pain," because I used to have it a lot, and it's basically shin splints, right?
It can
Or it's
be
is
kind of
it the
thought of
bottom of your
as
foot?
on the bottom of the foot. Yeah.
Okay,
So,
but
yep.
does it relate to the shin splints, or is that
You
completely
could
different?
you could probably draw some similarities
Okay,
in terms
but
of
the
like,
plantar is like the arch, right?
yeah. Yep.
Okay,
Yep.
because
So,
I had both of them, and it was hell. So I had to
yeah.
get like these big orthotics to get my arch in there, and then if I would run too long, then my shin splints would just go crazy because that muscle along my shin is like super tight or whatever it is. But you could
Yeah.
see that and be like, all right, this is what you need to do. You can expect this to feel better or how long
Yep.
or how much.
Yeah, exactly. And that's the point of having the CPGs so that we can be more confident on their not only what we're doing, right? So that we can tell patients like we're doing the most up-to-date research treatment that we know, or we can tell them, for example, like, yeah, don't go spending $200 on a new pair of whatever shoes quite yet. Like, let's try some more financially reasonable things first that should work before you go drop a bunch of money on something. Um,
Seriously though, because I did like they were $300 inserts that I had to get molded and I
mm,
wore them. It was in my soccer cleats when I was in high school.
yeah,
And I don't know if it did anything. Like
right.
they
Yeah.
weren't comfortable like wearing them. It was just brutal. But now I don't struggle with that anymore.
Yeah.
So it makes me
Yeah.
think, I'm like, did I even need all those things or should I just have gone to a PT and what do you do for instance plantar fasciitis?
Yeah. Yeah. Really good question. So first, based off of the evaluation, looking at, all right, like what are your limited factors, right? And so a lot of times individuals with plantar fasciitis, they have not very good what's called closed chain dorsiflexion. And so that's when your foot's on the ground and you try and put your knee over your toes. So kind of like a lunge
Oh,
position.
yeah. So like your
Yeah.
foot is, yeah, got it. Yep.
Yep. So a lot of times those individuals might have like poor mobility in that sense. So then it's like, all right, well, let's work on that mobility while we're trying to do some different pain modifying things, right? And so a lot of times the two biggest things, which it's not really like we're doing a whole lot as PTs, but one is honestly just time. Like that's the other thing. Just time with rehab guidelines. If it's just something like stretching, strengthening, some manual therapy to the area, so like some like soft tissue work or like some joint mobilizations. Those, if you do those just for a certain amount of time, that can make, just time alone, the nature of the healing can make it better.
If you're doing
Something,
it in a certain way, but if you keep doing it wrong, that time would essentially make it worse, though, right?
it
So like
could,
if
yeah,
you're,
yeah.
yeah.
And so that's where we bring in the second biggest thing, in my opinion, which is activity modification. And so
Yeah.
we
Okay.
look at what makes it worse. What are you doing? When the plantar fasciitis came on, did you start, running more? Did you
Hmm.
start doing something different with your lifestyle? And then do we have to, switch something like that up? So we modify the activity or modify the stresses to that area so that it can have time to calm down and heal, etc.
Oh yeah, don't stress it out even more while you're trying to fix it. Like
Hmm.
maybe
Yeah.
stop running for a little bit, do these techniques, do these stretches, soft tissue massages, and then see if it gets better, and then maybe wean back into the running or whatever the thing is that maybe caused it.
Yep. Yeah, exactly. And then you're just building up resiliency, right? You're just building up
Yeah.
tissue tolerance to whatever that is. And then there's also other things like orthotics have been shown to work. I just don't like to go there as the first line defense because, again, just financial reasons, right?
Bendy, exactly.
And so, yeah, you can get similar results if you don't do that right away. Taping has actually been shown to be pretty beneficial. So, like
Oh,
taping the
interesting.
arch to try and like give more support to that area.
Okay.
Things of that nature have also been shown to just help kind of push it along the path for just a little bit of like supplemental, stress reduction, so to speak.
Yeah. Yeah.
So yeah, so I would say it's kind of a mix of those things, but definitely just time and activity modification for the majority of physical therapy diagnoses are going to be kind of like your big hitters.
Yeah, okay. Because so the one, my uncle, like I said, was a PT, and I had like, I don't know, it almost felt like my shoulders. And I think what it was is either I was splitting wood or doing something with axes, or I
Hmm.
would just like sleep on them really weird. Like I would
Yeah.
just like huddle like this, and my shoulder would just, it would just felt sore all the time. Like it didn't hurt, but it was just like, kind of a tinging pain. And he's like, it honestly sounds like you have basically tennis elbow or tendonitis in your shoulder. So then he gave me this whole list of exercises to do, and I would have to lay down and like do a little bit of weight training and just little things. I was like, he just gave me these guidelines, like, yeah, this is what it sounds like. Try this and see if it helps. If not,
Yep.
we can reevaluate and then go from there. And I'm like, that was pretty much spot on because I've also had tennis elbow
Yeah.
before, and that's exactly what that feeling felt like. It's like this
Yeah.
weird thing. And he's like, yeah, so this is, and he explained it all, and yeah, it was cool. It's
Yeah.
it's a
In
it's a
general,
very cool.
right. In general, things just like to be loaded in the body, which seems like kind of backwards, right? It's like, oh, this hurts. I don't think, I don't want to do anything to it.
I don't want to use it. Yeah.
Yeah. And in general, the more comfortable movement, comfortable loading, things tend to get better in that area. And so that's another big thing with PT that we try and talk about is this a safe injury, right? Like when you come to PT, is this life threatening or emergent, or is the tissue like failing and do you need to go see like a surgeon?
Yeah.
And more like 9 times out of 10, that's not the case, right? Like they come in, you do the eval, and it's like, all right, there's nothing major going on. We know that this is a quote safe pain. We can just, as long as we just move the way the body wants to move it, and then we're going to be just fine. And I'll tell the patients a lot too. If you get pain with something, we're not doing more damage, right? We're not damaging the tendon or damaging the joint or anything like that. We're just it's just a little bit stressed. It's a little bit pissed off.
Yeah.
And so
Yeah.
it's just about managing those symptoms. And I think once you tell patients that, oh, my muscle isn't tearing or I'm not making anything like physically worse in there, it's just, more irritation, more sensitivity. People generally get a lot better once they're just put at ease, knowing that they're not doing something crazy to the body.
Exactly. Like kind of like a bone. If you have a bone
Yeah,
that's broken and you're using that, don't do that because the bone can't fix itself because it needs to stay stationary. But with muscles and
exactly.
joints and tendons, it's like, yeah, a little bit of movement is going to go a long way. Because I think what my uncle was saying is like the more blood flow you get to something, the more healing can take place and the more muscles can grow, and just like movement is good.
Yes, exactly. Yep, movement is good. That's a spot on analysis from your end there.
My cat just came down here and she's very talkative, so you might hear a meow if you can hear that. Lulu.
I hope we pick it up.
Louie.
Look at that little fur ball.
She's cross-eyed and a little bit blind, so she's a little bit neurotic. I don't think a PT could fix her.
What's going on here? Yeah, I don't think we can do much with that.
Sorry, Lou. But along the lines of treatment and like diagnosing stuff, what's like your favorite thing to treat or favorite muscle to work on or just favorite? Let's go favorite and least favorite to like
Yeah,
try to diagnose and fix and for whatever reason, if it takes too long or it's quick
yeah,
or yeah. So what's your favorite? Start with that.
yeah, yeah. I'm gonna. So there's gonna be a little bit of a curveball, but
Okay.
because I would consider myself like I have my OCS, which is an orthopedic certified specialist, right? And so the OCS, you take a big test and you basically just have letters after your last name that says, I'm a
You're important.
specialist in orthopedics, right? Myself and Christian, we both have that. So I would consider us both orthopedic specialists. Um,
Orthopedics is like bones and feet and hands.
I wouldn't necessarily go as far as like specifying like a certain part of the body, but yeah, like
Okay.
bones and muscles and
Bones.
tendons,
Okay,
stuff
that's
like
what I
that.
thought.
Yep.
Okay.
But my favorite thing to treat is honestly, so I also see vestibular, so like vertigo, dizziness, that type of
Yeah,
stuff.
yeah, like inner ear stuff.
Yeah, yeah. And
Interesting.
within PT, I would say like the one thing that we know helps people out, like without a doubt, we know for a fact this is going to work. If someone comes in with vertigo and we throw you in the goggles, we do techniques and we see your eyes move in crazy
Okay, what are
ways.
got?
Okay, yeah. So they're infrared goggles. So you put them on the patient's eyes and it makes them just go pitch black. They can't see anything. But the goggles show up on a screen, so you have these two little eyes on screen, so you can see the eyes very well.
Interesting.
Yeah. So within vestibular, when someone has true vertigo, which the technical diagnosis for it is called BPPV.
Okay, yeah, yeah, yeah. It's something with like the crystals in
You
your
got it.
ears and yeah.
Yep.
And
Yep.
do their eyes like kind of shake and
Yeah. It's called nystagmus. So it's a repeated eye movement that fades away within 5 to 30 seconds, give or take.
okay, that's insane that you say this. I don't know if you can see my cat, but
It's
her
definitely
eyes,
cross-eyed.
but they constantly shake. I guess
Okay.
it's common in
Interesting.
Siamese,
Oh
but
wow.
like she can never focus on anything because her eyes are just like,
Yeah.
so I don't know
Yeah.
what her reality is. Anyways, so
So yeah.
okay, so you can see if they have this shaky eye and that's affecting their balance, right? They're just
Yes.
kind of spinning and just uneasy.
Yep. Yep. So when the crystals aren't in the right spot, what happens is when you lay down in bed at night or you get up or bend over, and whenever you change the position of the head,
Yeah,
the
they can.
crystals move where they shouldn't. And that causes people to feel like they're on a freaking merry-go-round going a million miles an hour. Like it's
Oh
very
yeah.
intense. And when we're in the goggles, when we put them in a certain position and we see the eyes move a certain way, I can say, you have right posterior BPPV, and this is what we're gonna do.
Do
It
you do
takes
the Epley maneuver,
yes, yep, you got it, yeah.
or the Dixie Normus or Dix something? What's the other one?
So the Dix Hallpike is the testing position.
Yeah. Okay, it's really tough that I know this because this is a side story. I was recently at my girlfriend. My girlfriend lives in Nashville.
Yeah.
And I had this crazy dream, and I'm like in my childhood bedroom, and this random guy comes in. He's trying to like pull out my dresser drawers. And I'm like,
Okay.
dude, you can't do that. They're gonna break. And then he leaves and he comes back and he starts doing it again. And I just remember trying to smack him as hard as I could. And I woke up and I actually hit my girlfriend in the side of the head.
Oh my
And
God.
she's like, Jake. I'm like, what did I just hit you? She's like, yes. I'm like, oh my God, are you okay? But then she was like dizzy all that day. And she was like worried that she like got up and dizzy. And she talked to her friend who's an audiologist, and she explained all this, the BPVD or whatever it is, and the Epley and the Dix. And like, we were doing these tests. She's like, is there any way that like Jake could have dislodged my crystals by hitting me? And I'm like, oh my God, that would be insane. Could that have happened?
Yeah. Yeah, that can happen where you get a strike to the head. It could
I mean, I
dislodge.
don't think I hit her. I don't think I hit her very hard because I don't know. I was sleeping, so like,
Yeah.
I don't beat my girlfriend. I
I was
promise.
just gonna say, do you want to explain this a little bit more for the record?
I promise I don't. But then we did like the dicks to try to see which ear it was, right? That's kind of how you see which crystals are not aligned. And then
Right,
she
left,
did like the
yeah.
Epley. But yeah, that's insane that I know a little bit about that because it literally just happened last week that I
Yeah.
was going through all this, but I didn't know that PTs kind of did that kind of stuff.
Yeah, so yeah, that's a different line of physical therapy that a lot of people don't know, and that's called vestibular therapy.
So
And
cool.
so when I got hired right out of PT school, they asked my supervisor asked me, "Are you comfortable seeing vestibular?" And I'm a new grad PT, and I would say that my PT program, it kind of differs. Some PT programs don't get too much into it. We had like 2 weeks of vestibular therapy and training in PT school. I would argue that that's probably on the more in-depth side of things. When it comes to PT school, a lot of people I talk to only get like, a couple of days, maybe a week.
Interesting. And then a
And
lot of
so
their experience comes from practice.
practice or taking like continuing education courses and yeah.
Okay, got it. But
So,
that just kind
so
of gets your foot in the door to like, all right, this is what it is. We can learn about it and treat it or whatever.
right. And so I told my supervisor just, I don't know, I was a wide-eyed new grad and I'm like, yeah, I can treat vestibular. Of course. Yeah, I like that. I can do that.
Easy.
Easy. And then I started doing it and I was like, oh shit, I
What
need
am I
to learn
doing?
more. So I took a couple of continuing ed courses on it, and I feel much better about it now. But no, that's one thing where they come in, you do the Dix Hall Pike, they're super dizzy, and you can be like, "Yep, I know exactly what it is." You can go right, literally from the Dix Hall Pike test. You can go right into the Epley for treatment, and within like 10 minutes, I would say 6, 7 times out of 10, they get out of the glasses, they lay down in bed, and they're like, "Oh my God, I'm not dizzy anymore." And it's
Yeah.
it's one of the things in PT, I would say one of the only things that like they can walk in feeling like shit, and within 45 minutes, they can leave feeling way better.
Yeah. Just so it's like an immediate thing, and that's what you love about it because it's like, hey, I just fixed this. Because a
Exactly.
lot of PT
Yeah.
is kind of long term. Like for my shoulder, I was doing it for I think like 3 weeks.
Yeah.
And then I
Sounds about
started
right.
to notice the difference, which
Yeah.
is great too, because then that doctor is like, hey, you followed all my recommendations, all my techniques, and now you feel better. Like that's also fulfilling. But there's probably something about like, you have a problem, I can fix this problem within an hour. Like I bet that feels awesome.
Oh yeah, it feels so good. And it's really nice when the patient just like, you can tell they leave just in a better spot. They're very appreciative of it. And so yeah, so that'd be probably my favorite thing to treat.
Which
And
is funny
then
because that's not what and I'm sure the layman's out there, I wouldn't consider that PT. So that's very
right.
interesting.
Yeah, yeah. And I should also give a little bit more love to vestibular therapy. That's just one leg of it, right? There's different things going on that can happen in the inner ear that can make people dizzy. It's not always just the crystals are loose. And
Yeah,
so
yeah.
you have
But
to
that's
kind of,
probably the most common or
yeah, I would say, yeah. Yep. So that would be my favorite. My least favorite, probably the individuals, and it's no hate on these individuals. It's just this can be a very difficult, draining thing to treat as a clinician.
Mhm.
And that's individuals that have like kind of uncontrolled chronic pain, right? So
Okay.
they've had back pain for 20 plus years. It's debilitating to their life. You know, they've seen every doctor under the sun. No one can
Mm,
quite figure it out. And so they kind of last resort send you to PT, and then you're doing stuff. A lot of the times the patient is always like, yeah, I've already tried this, I've already done that. So you're trying to find something new to do. You know, you might see them for 10, 15 visits over the course of like 3 months. And sometimes, unfortunately, you don't even really crack into their pain a whole lot
yeah.
because they've just the brain gets really good at, because pain is a defense mechanism, right? And so the brain gets really good um at protecting themselves, and it gets really good at learning these habits, and a lot of it is just trying to get the patient out of that vicious cycle.
Yeah.
And so some PTs are, they see that a lot and they do great work. You know, I admire those PTs because they do a lot of dirty work in that sense. But you know, it, and that stuff can also be very rewarding too. You know, if you get
Yeah,
someone that
very
comes in with
fulfilling.
that, and if you can make them better, and then it's like you're, you know, you're kind of their saving grace in terms of what was
Yeah,
able
you're the
to,
hero.
yeah, make their life less debilitating. So yeah, I would say chronic pain in that sense. And the other thing too that's hard about that is a lot of times, unfortunately, it surrounds the low back, right? A lot of the low
Yeah.
back
Back
pain, people have had it
pain
for years.
from years ago and it never healed properly. And then it's like,
Yeah,
can you do anything about it? And you're trying to, but it's like, you don't want to give up, but it's
yeah,
like,
exactly. And
yeah.
yeah, and so it's so, and then also with the low back pain, they come in and they've seen all these social media accounts, they've read things online, you know, and like you're trying to weed through of like, yep, that's true, that's completely false, that's, you know, and you're trying to educate these patients who for 20 years have been learning and knowing things from various different people. So that can be tough as well, just very emotionally and cognitively draining at times. But with that being said, as a quick caveat, I don't want people listening to this be like, Eric doesn't like to treat anything difficult, I guess.
Yeah, like, wow, great.
He's
He's a
just hopping out,
hack.
taking, yeah, exactly.
He just wants to joggle your head around and fix your crystals.
Right.
But that's a tough one though, because it's like it's almost you don't want to say it, but it's almost too far gone. Maybe if they saw you within the first 5 years of that pain, something could have happened. But
Could have been
it's
different. Right.
yeah. So
Yeah.
it's like I don't know. I don't know. It's no one's fault really, but
No,
the
yeah. And
person
that's,
with I don't know. It's not your fault that you can't fix, and it's not their fault that they're still in pain. But I don't know
yeah. Pain's just, it's a very hard thing. It's a very complex.
because it's
We,
also up here.
Yeah, and so that's a great lead into something else with physical therapy. And Christian and I have talked about this before. There's different kind of models of thought, right? There's the like pathoanatomical model, which is you have a pathology of an anatomical tissue, right? So like your muscle is torn or your bone is broken. Like that's very pathoanatomical. As PTs, we're taught in PT school about what's called the biopsychosocial model, and so that's thinking that pain is, yes, it's very much biological. It's the tissues, it's the pain response, you know, the chemicals, all that stuff. It's also psychological. It's also
Mm,
social. Pain is a multifaceted response in the body that unfortunately can't just be treated with the anatomy or the biology, especially in chronic
yeah.
pain.
There's
There's,
a level of both that you need to somehow tackle.
yep, yeah, absolutely. Yeah.
And
So,
that's why it's so much easier to just be like, here, take this pill. It'll help the
right.
pain.
Yeah.
And it's like, and sometimes, so my grandpa, he had Parkinson's and dementia, and we actually went to a PT. Do you see Parkinson's patients?
So I don't, but we have two PTs in the clinic that do. So,
Yeah. So
yep.
like for them, it was more like keep your body moving, get your
Hmm.
joints moving, get your motor functions moving, because that's what Parkinson's kind of attacks, like your motor functions. So like he went in, I think it was like once every couple weeks or once every week, and he would just do like light training and just like some balance stuff and
Yep.
but he's always had chronic pain in his back. And like they didn't even try to treat that because he's like, I mean, I've had it all my life. I'll just take
Yeah.
some meds for it to kind of ease the pain. And that's so
Yeah.
to a point, chronic pain, it's like, I don't know, meds are there for a reason. Like You don't obviously want to abuse them and get addicted to them, but they have their place where to make you a little bit more comfortable if you can't get the help from a professional, a PT, and movement and exercising.
Yeah. Yeah, exactly. And that's a very good point that you bring up. I tell especially post-operative patients, right? Especially after like a total knee replacement or something, right? I tell patients all the time. I say, the surgeon, they prescribed the medication for a reason, right? It's there to help you out in the first week, couple of weeks to just kind of get through the initial post-operative pain. And then you wean off of it, and 9 times out of 10, people are freaking good to go.
Exactly. And then they do physical therapy for the next 7 months or whatever it is, and
Yeah.
slowly get their mobility back and get rid of that pain and should be good. But with the chronic pain, it's tough because they didn't have that initial help, I guess.
Yeah.
So then it's like for my grandpa's case, he just kind of had to cut his losses and like, all right, I'll just take meds, kind of help out. He wore a brace too every once in a while.
Yeah.
I mean, he was like 83, so it's like, I don't know, what do you do? Like, do you want
Yeah.
to He hated going to PT for one. He's like, do I have to? I'm like, yes, you have to. It was like the Big and Loud program. I don't know if you
Yep.
guys have.
Yeah.
Yeah,
Yeah.
so
That's
like,
yeah.
because that's also another thing. It affects their voice, Parkinson's. So they would have to like stand up and go, wow, like
Yeah.
shout and like do certain things. And he just hated it.
Yep.
He's like, I just want to go home and read the newspaper. I'm like, Grandpa, we're doing this.
Yeah. It's when you bring that up, we'll like the PTs in clinic that see Parkinson's, we'll be like treating, like we all share the same gym space, and I'll be treating a patient in the gym, and then out of nowhere you'll just hear like bah, and you're like, Jesus Christ, what the? Oh, okay. Martha just has a Parkinson's patient over there. But yeah, unfortunately with Parkinson's too, the other thing is rigidity. So people can get to be very rigid,
Yep,
and we know that with low back pain, part of it is also just the muscles get to be so stiff.
exactly.
And
And
so
that's where I was saying movement is so good.
yeah,
If you stay stagnant, your joints kind of lock up, your muscles kind of lock up, and then it's even harder to move. So like you need to have a little bit of like what you were saying, a little bit of stress to
yeah,
kind of keep things going.
right. Yeah, absolutely. Yeah, no, very good points. Really good questions there in terms of talking about what's your favorite thing to treat, least favorite, and diving into the whole like movement and how important that is.
So like since you're working with you basically work with patients all day, like your day to day. What's your day to day actually? Let's go with that first. Wake up early, go into the not an office, the hospital or wherever you work.
Yeah,
Just
yeah,
yeah.
yeah, absolutely. So yeah, it's for me. I start seeing patients at 7, and so 7 a.m. Start seeing patients, and so I'm usually there, a little bit before 7. I personally like to make a breakfast and then bring it to work, so then I can have my breakfast while I review charts for the day. Look over who I have,
Nice.
um, get a sense of like, what am I going to do for each patient? What am I looking for with each patient? That type of stuff. Just so you have a
Yeah.
plan going into it.
Or if you've had them before, like, oh yeah, I remember her. We've been
Yep.
working on this. We can ask about this and see if things are improving and whatnot.
Yep. Exactly. Yeah, and go from there.
How many
And
patients do you see a day typically?
yeah, so usually somewhere in the teens. It can
Oh,
vary.
okay.
So it can be as low as like 10 or 11. If it's a slower day, it can be as much as, give or take 15, somewhere in the middle there. I'm
Kind of a
actually,
lot. Oh,
hey,
hello.
Christian's
Hey, what's
on.
up, gentlemen? Hey,
Hello.
how's it going, Jake?
Good.
Nice to meet you. Thanks
Yeah,
for
nice to
being
meet
here.
you.
Sorry, I'm like an hour late.
No, you're good. We're just getting started, baby.
Just getting started. Okay. All right. Good.
Well, this is a perfect question for you too, so we can, I guess, see the difference between your guys' day. Maybe it's exactly the same. I just asked Eric, like, what is your typical day? When do you get into the office or the clinic? How many patients you see, and like, where does it go from there? And you guys maybe see in the teens amount of patients, which seems like a lot.
Yeah, it's a
Like that's a
lot.
long day.
Yeah, I would say for the average orthopedic therapist, they're probably going to see 12 to 20 people a day, depending on what kind of clinic you work in, you'll probably have 1 to 3 or 4 patients at a time. It all depends on who you're working for. You know, you could have a bad boss or a good boss. Right now I have a great boss, and so I'm only working with one person at a time. I get 30 minutes one-on-one, and then they get to work with an athletic trainer for a little bit and finish up with their exercises. But a typical day for me is I work 4 10s, and so I'll get up at about 5, get ready, head out the door, drink my protein shake smoothie thing on the drive into work, and then do about 30 minutes of chart review.
Do some lifting or no?
No, that's in the evening.
Oh, okay, got it. Okay.
Yeah, and then I see probably about like, I'd say 13 to 18 patients a day, depending on just how the caseload shakes out that day. And then, and then try to lift in the evening. So it's a long day. Yep.
Yeah. And is that what you do too, Eric? You lift?
Yeah.
I mean, do you guys just work out every day, I'm guessing, or no? Is that... every PT is just super, even super built, but just like super healthy. Because I mean, Dom, our buddy Dom is a PT, and he's just like, it's looked like he's chiseled out of marble. Like he's just like this perfect specimen. And I'm like, dude, you're making us all look bad.
Yeah.
More like warm butter for me.
Hey, butter is great though. We love butter.
Yeah. Dom's living that Southern California lifestyle.
That is true. He's got to be pretty. He's got to be pretty up there.
Up.
Yeah.
Yep.
But I would say in general, I have a similar day to Christian in terms of, I also work 4 10s. And so I'll see those similar amount of patients. And then it's usually, I see one patient every 45 minutes. So I'll do one-on-ones in the morning, a little break for lunch, and then afternoon. And then, I try and get a workout in at night. Also with the side business, I see some Winona State athletes here in town on the side. And so, like today I got home at about 6. And before we jumped on the podcast, I had a football player come over and we worked on his low back for an hour or so.
Nice.
And so that's I would say a typical day. And if I have time in the evening, and then I'll try and get a good workout in, or really just make most of my time on the weekend worth it, right? So being able to prioritize the weekends and having a healthy lifestyle there.
Yeah.
But
so you guys see, or some PTs see multiple patients at a time. How does that work?
I think Christian can talk better on that than me.
Yeah, so my last job, which I had for 6 years, we would see 2 to 4 people like every hour on the hour. And it gets to be a pretty well-oiled machine where you'll plan to see, okay, I've got 3 this hour. I know that person number 1 needs about 15 minutes of hands-on work. Person number 2 needs about 30 minutes. Person number 3, they can just do all exercise. And so the people that are going through the exercise are going to work with the trainers to start. And then I'll just bop around kind of like a host at a party. I'm just moving around, shooting the shit, doing what I got to do to fill that hour and get things done. But that's when you have help. But one of my coworkers, she left her job where she had 2 people at once every hour, but it was only her. So she'd be like massaging this dude over here, then like telling this guy to do this exercise, and just that's not good for anyone. No one likes that.
Yeah. That's just like the medical field, like, all right, let's cram as much people as we can, make a lot of money. These guys are just numbers. They're not patients. We're not trying to help them. We just want to get as much money as possible. Whereas like medical profession, you need to actually spend time with the person to fix what they need and, I don't know, learn about their body. So like what you would do, we were talking about my shoulder. My uncle's a PT, and I kind of had like some tendonitis in my shoulder, and he gave me these, just from home, he gave me these exercises. So all these people would be doing these exercises in the clinic with trainers, and then you'd kind of go around and ask them like, how are you feeling? Seeing if they're doing it right and certain things like that.
That's exactly right. Yep.
Okay.
Just talking about their plan for home. How's the progress? Are you getting better? Are you not? What should we be changing? Should we be talking to your docs? You're handling all that stuff on the fly as you go through, while the bulk of the true exercises are done either with the patient on their own or with a trainer guiding them.
Mm-hmm. I was kind of thinking it was going to be like aerobics, like you'd have like 3 patients in front of you and you'd be doing like the exercises.
Dude,
like
that's actually a thing. That's a thing. That's a thing. It's called group therapy. And no, I do not do that. But you can. Yeah. You make like no money doing that, so that's why no one does it.
I got it.
Yeah.
But I was telling Eric, I lived with my grandfather, and he had Parkinson's and dementia, so I would bring him to PT, and he would do like the big and loud, the movement and the voice, and then at home we would have like a homework to do that he would need to like stand up and do certain things to keep moving. So a lot of it is also at home that the patient has to do themselves, and then kind of report back to you guys and be like, hey, this is what's happening. Is it working? Is it not? Whatever.
Yep. That's the best
Cool.
way to
Yeah.
do it.
Very
Yeah.
cool.
Now, the hard part is convincing them to get that stuff done on their own. And that's
Uh-huh.
that's what separates the good versus bad therapists, is how do you get folks to buy into the plan and do the thing?
Yeah. Well, it's like it only benefits them. So it's like if you don't want to do it, you're not going to feel better. So why wouldn't you do it? Like if you're really in pain, do these exercises at home and you might feel better about it. Don't just come here and complain that it didn't work if you're not doing it.
Everyone just wants a pill. They want to get done
We
yesterday.
talked about that
Dude,
too.
I
And
get it.
there's a time and place for it though. Like the super chronic pain, it's like that's a tough thing to fix if they've had pain for 20 years of their life. Maybe there isn't anything you guys can do, so it's like we might just need to treat the symptoms.
Yeah, you're going on the topic of management versus cure.
Yeah.
A lot of what Eric and I preach, which is just the way medicine and rehabilitation work, is that a lot of these conditions that we treat are more about managing. Think about it like depression or anxiety or diabetes. You don't intend to cure those. They might get well managed to where you can live a full life, or they might go into remission, but they're always there in the background. And you got to figure out what's the best mix of meds and counseling and exercise, whatever else, to keep those things at bay and keep you living a full life. And that's more about how PT needs to be thought about. Sure, like there are things that we can quote unquote cure, but that's not what you should be aiming for all the time, because it's unrealistic.
Yeah.
Yep.
That's a good analogy for sure. So what I was asking Eric, what is your favorite thing to treat and your least favorite?
Favorite thing is more of a population, I would say. I love working with people who like to lift or like to run. And so right now I have a patient who, she has low back pain, but she likes to Olympic weightlift, so snatch and clean and jerk and lots of squatting. And that's what I'm doing currently. Yeah.
Snatch and clean and jerk?
Yeah. So that kind of stuff just gets me fired up. Like I cannot wait to work with her. When I'm working with her, I'm just super excited. That stuff is the most fun for me. And then
so it's not a specific, but it's more of like the general, because that's your hobby too, or that's your interest. So like you want to see these patients that do that as well.
Yeah, selfishly, it's all about me. It's like what I like to do. And that's, you just gotta be real with who you are.
Yeah.
But least favorite thing, I would say low back pain. I love it and I hate it. I love it because it's incredibly important. It is the #1 cause worldwide for disability and decreased productivity and lost income and all that. It's like a horrible burden on human society. It can be incredibly rewarding, where if you help someone who's had 20 years of low back pain begin to get that thing better managed, they're like, wow, you just changed my life. Or someone comes in with like or they come in with a tweaked back and you just like bust out a chiropractic style adjustment. You crack their back once, they're like, dude, I am fixed.
Yep.
That stuff, that makes you feel good, but it doesn't happen that often. More often it's like, oh my God, this person's in a lot of pain. They're frustrated because it just hurts. They're not getting that much better. I'm doing all the things I know.
Failed, quote unquote.
Right. And then you're like, man, I'm just a bad therapist. I'm awful. It sucks. So it's a bittersweet one.
That's exactly what Eric said too. He's
I was going to say, I think
pain is,
yeah,
it's just tough because it's like, you feel like you failed, but then you can also feel like amazing. Like, oh, I just changed this person's life. And my mom, so like she's tweaked her back a few times. And like I said, my uncle is a PT, and like she would tweak her back and like just be immobile and just like terrible. And it was the worst thing ever. And then he would come do some like exercises or like put her legs up and do something crazy. And then she'd be like, oh my God, like that was it. Like I'm good now. Like, yeah, sure. A little sore, but like I can actually move. And it was just, I'm sure that's just amazing feeling.
Yeah. Well, Jake, have you ever had low back pain?
Not really. A little, but
yeah.
Sorry.
Well, you're lucky. I hope it stays that way. When I was in grad school, I tweaked my back real bad to the point where it was like what you just said, where after I tweaked it, I physically could not move. I was just incapacitated, lying on the floor in my apartment alone. I only got up twice that day. I got up twice just to piss and I don't even think I ate that day. That was all I did. And the next day, I think I got up like 3 or 4 times, but it can be incredibly crippling in that like real acute phase.
For 20 years.
People
like
do.
Obviously you couldn't move for 20 years, but like that amount of pain or that amount of disability would just be hell on earth.
Yep.
So
that's why opioids are a thing.
I know. And that we were talking about that. Like they're there for a reason, but obviously it's a very slippery slope for a lot of people. But like my grandpa, so he did the PT for the Parkinson's and everything, but he's always had super bad back pain. He would wear a brace every once in a while, but like we didn't even bother to try to deal with that. It's like, we'll just treat symptoms and just kind of go on our way. And he was fine with that. And that was kind of because he hated PT. He's like, do we have to? I'm like, yes, Grandpa, we have to go. And like his therapist, he was so great. And Grandpa was always super nice with him. But he's like, I just want to sit in my chair and read the newspaper and watch TV. Like, I don't want to have to do this.
Be a curmudgeon. Yeah.
But didn't like PT. Sorry, guys.
You bribe
no
them
one
with
likes going to PT.
You bribe them, say we'll get some Dairy Queen after if you go.
Culver's.
Get some Culver's after.
Exactly.
Now
Culver's custard.
There we go.
We'd always do that. Be like, all right, Grandpa, we're going to Culver's after. He's like, we better. Like, yeah, we will.
I found out my grandpa goes to McDonald's every day and he gets a strawberry milkshake.
Hell yeah.
It's like for years. I had no idea. It's just this big mystery. But that's what he does.
That's awesome.
That's awesome.
Oh, man.
What is the one free piece of advice you'd give to people like me? I'm somewhat active, but I don't lift weights. I don't run. What would you give to me? Because I'm 32, getting to middle-aged, I guess you could say. Not really, but to keep my body healthy. Would you suggest me lifting every day or working out or this, or is it a diet thing? Or what would you guys say as medical professionals?
I guess I'll go first. When it comes to physical activity, the only bit of wisdom I'll share with you there is find what you like. And when you get bored of something, move to something else. The worst thing you can do is just be married to one particular style of training. And then let's say you get hurt or you get kind of burnt out and you just give up and you don't do anything. We see this all the time where folks are super invested in soccer or powerlifting and the season ends or they get a little tweak and they just stop doing anything or they just get bored and they're just like, I'm kind of burnt out in this thing, but I don't know what else to do. Find something, just anything, just keep moving. Because that's going to check like literally anything. That's going to check all your major boxes that you need to decrease your risk of all-cause mortality, various other ailments. And then aside from that, I would say find some form of cardio. Doing cardio is like the elixir of life. If you can figure out how to do sneaky cardio, whether for me it's running with my dog. I don't like running alone, but I'll run with him, and that's how I get it done. But some kind of cardio is critical to your long-term health, not only your physical health, but your metabolic health to keep cardiovascular disease at bay, diabetes, blood flow, all that stuff. Like no one likes cardio. I guess some people like cardio, but most folks don't enjoy cardio, but figure out a way to like it.
But so interesting you say that. You have to almost trick your brain. Like for me, running, awful. Walking, stupid. But I love splitting wood. I'm an axe guy. I showed this earlier.
Shirt on or shirt off?
I'm not Thorin Bradley, okay?
I'm
sure you know who that is. But it's funny because me and him are actually like buddies on social media.
No way. Okay.
Like I make fun of him or like every video that goes viral for me of splitting wood, they would comment his name. Like, Thorin Bradley, have you seen him? Blah, 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 blah. And then he would comment, be like, yeah, Jake's the man, blah, blah, blah. And then we would just like talk back and forth. So, but I'm a very different wood splitter than Thor because he's a beast to be honest. But like, that's my form of cardio, like lifting the super heavy logs, splitting wood. And like, that's fun for me. But like my heart's racing after an hour of doing it. And like, it's good for your body. And it just basically just tricked myself like, oh, wow, I'm doing cardio. Like that's
and
amazing.
Your body doesn't care. As long as you're getting your heart rate up, you're exerting yourself, you're in good shape. And what's nice about what you're saying is you're doing high intensity cardio. So your heart rate's probably spiking over 140, 150, 160. And what's really cool about doing high intensity cardio is you have to do way less of it per week to get the same benefits as very slow jogging or walking.
Interesting.
Yeah, so we have
like
guidelines.
Your heart rate's going up super high and then kind of coming back and then...
It's more bang for your buck. That's all it is. Huh. Yeah, we have guidelines.
And I'm getting work done, which that's
And you're getting work done.
And you're getting that wood split.
Exactly right.
It's cold in the winter.
Exactly right. Yeah.
growing your
Yeah.
channel.
And content creation. So it's like, and that's what I love about that, because running, the only goal is cardio and maybe some joint movement and muscles or whatever. But like, if you're a framer or if you're a wood splitter or something where you're actually moving and getting cardio up, you're also getting another result. You're getting your wood split, or you're building a house or something. So it's like, yeah, it's kind of cool. So keep splitting wood, keep moving. Cardio is what you would
Only
say
if you
to.
find it fun.
Got
And
it.
yeah, so here's the thing. This is
So what if
I
someone
don't
finds
yeah.
no movement fun?
Yeah, well, they're gonna have some problems, and as long as they're okay with having problems like that, hey, that's their life to live, man. I'm not here
Yeah,
to
they
say
can have fun
otherwise.
up until their back just shrivels up and gives
That's
out,
right.
and then
Yeah.
Yeah.
Yeah. Eric,
and
what
then
do you
what would
think?
you? Yeah,
Yeah. Well, that's a hell of an answer there, Christian. I would say for me, and this is gonna be more broad in terms of lifestyle, but I would say moderation and everything. And I'll get into some details about that. Like moderation and everything, including moderation. Like so like every now and then, I'm a proponent of this. Like I'll have patients who they'll have a busy ass week. They're putting in the time. So Saturday, like just take the day off, right? Just
yeah,
take it easy, let the body rest. Even like The Rock does it with this whole cheat meal thing, right? Where like he'll just eat like 20 frickin' pancakes and 3 packages of bacon, whatever it is, where it's like, yeah, like allow the body just to enjoy something, right? And not be so rigid all the time. And so, but yeah, moderation in terms of like even physical activity, like allowing your body that time to rest and recover so you don't overwork things.
yeah. So if you were just moving and splitting wood all the time, that's just unneeded stress on your body, right? Like
Well, yeah, I
that
would
could
I would
maybe do
argue,
more harm than good.
especially if you're first starting out, right? Like if you've never split wood before, maybe start with the smaller pieces and only do
Yeah.
20 minutes of it versus
Good God, my light, my light just fell.
but yeah, I would say not trying to climb Mount Everest on day one, right? And take things in moderation and not feel like, I haven't ran a mile in 10 years or something. Well,
Since
maybe,
probably college or high school, yeah.
yeah, maybe walk jog a mile, right? So maybe do a 3-minute jog followed by a 2-minute walk, by another 3-minute jog, by another 2-minute walk until you hit that mile point.
Yeah, yeah.
And so, yeah, and then yeah, just allowing the body some time to rest and recover, and even in things like nutrition, right? I always tell patients like 80% of what you do should be really healthy stuff, right? Get your vegetables in, stay away from the sugar cookies throughout the week, try and be very healthy in what you put in and do to your body 80-90% of the time, but allow for a little bit of time to indulge in whatever the thing you want to
Yeah,
indulge in, right?
but it's okay to kind of just let loose a little bit. And I feel like that's also mental as well. Like we kind of talked about how pain is just as mental as it is in your muscles in your body, but same with like nutrition and movement and stuff. Like give your body a break, give your brain a break, give your muscles a break, and just I don't know, don't be so hard on yourself.
Yeah. Yeah, I would agree with that. And like this is something that I think, well, actually I think all three of us can agree or be able to relate with. But like, for example, Jake, we were talking like after this, I'm gonna hop on and play some Call of Duty with my brother. And it's
Yeah.
like I'm not gonna sit here and study my orthopedic
Read
book
your
until
yeah,
midnight. Yeah, I'm gonna go enjoy a little bit of brainless activity and just have fun
yeah,
for an hour or two,
exactly.
just to give the brain a little bit of a break. So, but yeah, I think just recapping both of the, like Christian said, cardiovascular or just any type of movement, get that heart rate up. But then also, as you're getting into these activities or wanting to pursue a healthier lifestyle, remember that moderation and everything, even in moderation, allow the body, allow the mind a little bit.
Yeah. Yeah, that's great.
But yeah, so anyways, anything else on your mind there, Jake, that you wanna talk about? I know I'm looking at the timer and we're
Yeah, how long have we been doing this?
we're almost 90 minutes in. So
Hell yeah.
This will be a two-parter. Yeah,
I
that's
mean, I
it.
am. I don't know if you guys are, but
I'm having a great time.
Not being a lecture. That's the thing. Is
Yeah,
like
right?
Eric and I,
Yeah.
we are really trying to be different in our space. 'Cause in our space, it's almost everyone is just lecturing to you, which is great.
Yeah.
I like that because that's the kind of stuff that I need to do to get better and learn. But normies don't like that. Normies just want to have a good
Exactly.
time
Yeah.
and learn a
They
little
want
bit.
to. Yeah, exactly. It's like, that's a cool piece of information. And exactly right. Like, we don't want to watch, I mean, we probably all did this in college. Like, you watched lectures, like a professor reading a book and doing this. It's like, oh my God, I don't want to do this. Like, why would I want to spend my off time? Because that's what podcasts are for. Your free time to like learn about something or find something interesting. Why would we want to just watch a lecture on that? Like, no one that's not interesting. So you have to kind of find this mix of information, helping people, like what you guys do, but then also entertaining them. And I think it's great.
And as I was sitting there listening to you guys talk back and forth about podcasts and like what we're trying to be here, Christian, I'm like, don't cut that out. That's like, that's a good
Yeah.
piece. That's a
You can add whatever
sum
you
it up.
want. But
Keep that in. Like, that's good for the audience to know. But yeah.
great. So wait, are
Yeah.
you in East Coast?
Yeah, I'm in Maine.
Oh, got it. Okay. I thought for some reason, I thought you guys were both at Winona.
No. I met Eric here
But you guys
in Maine.
met. Yeah.
Yep.
I knew that, but I thought then now you guys work together here, but you just did the podcast virtually from across the country. That's
Yep.
cool.
Yeah.
Yep.
Teaching me and hopefully teaching the audience, and like, I just wanted to put a voice to the people that are watching that aren't professionals like you guys. Like, all right, what is PT? What do you guys do during the day? What should I be doing? And just kind of, I don't know, bring it back down to like the layman's, like, that's who we are if you're not a PT. Anyways, yeah. Thanks for having me, guys.
Thank you.
It's been a
Thank
good
you,
time.
Jake. We appreciate it. Well,
Thanks for having me again, and we'll keep in touch. Eric, for sure.
yeah.
Keep in
Well,
touch. We'll be gaming together. Christian, it was
I
great to
hope
meet
we
you.
keep in touch.
Nice meeting you, Jake.
Yeah.
But all right.
All right.
Well, we'll see you guys later.
See ya.
Later.
Bye, Jake.